are streaming live spine surgery. It is Thursday, August 20th, 2026. Our patient comes here from Spring Hill, Florida. She has horrible neck pain. This is coming from two sources: her facet joints, which are full of arthritis, and two herniated discs. We're going to start by treating the facet joint pain in her neck. There are 30 very specific causes of pain in the neck. The facet joints are the second most common cause. The disc herniation is the most common cause. She has several disc herniations. Only two of them need to be operated on. We're going to be doing that in a little later. We're starting with treating her facet joints. Let's show the audience why people get cervical neck pain from facet joint injuries. You can see from our video that patients develop facet joint pain when they have an injury to their facet joint. This injury is called trauma, and the traumatic injury to the facet joint tears the capsule wide open. The capsule is what holds your bones together in your facet joint. When you tear that capsule wide open, the bones actually start to move abnormally. And that abnormal movement of the bones generates something called instability. Now, instability is defined as severe pain or the development of a neurological deficit associated with an injury to the spine, okay? Which she has, by the way. She has pain and she has neurological deficit. Right now we're treating her facet joint pain on the right side of her neck using a technique called the Deukmedjian rhizotomy, which is basically using a radiofrequency probe that has much more energy than the typical RFA probe that most pain management doctors use. And we've used this probe for years to perform these treatments. It works very well. The downside is, for the patient, the recovery is an hour, but it hurts. The pain from the procedure is not insignificant, and it can last for weeks. Most people, it's just a few days. Any questions from our audience? Sean?
No questions.
Okay. Good. We're going to be done in just a moment with the right side facet treatment. We're going to move on to the left. Let's show the audience how this whole facet treatment works.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deukmedjian rhizotomy. the inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, welcome back. You've seen now how we use we call it the Deuk plasma wand, and we go in basically with a 4mm incision and destroy all the pain nerves that are overactive at the facet joints. Their name for these nerves is called the medial branch of the dorsal ramus. Medial branch of the dorsal ramus. Jordan, show the audience on that x-ray right there. Show them where the arthritis is. You can see severe arthritis. Shot. And that's really what we're here to fix, is that severe arthritis. Now, I can't get rid of arthritis without drilling the bones away and doing major surgery that's highly invasive. So what we do instead is we just go in and destroy the pain nerves to those joints. Shot? So we use x-ray guidance to do that. That's what we're doing right now. Okay. Any questions from our audience?
Yes, we have a question from Aza on YouTube.
Hi, Aza. Welcome to our stream.
Dear Doc, does DLDR work for spondylolisthesis?
Yes, DLDR does work for spondylolisthesis. Absolutely. And the reason why DLDR works for spondylolisthesis is simply because spondylolisthesis doesn't cause symptoms. What causes the symptoms is the disc, and the disc causes back pain, or if it's in the neck pain. And the other thing that causes symptoms is something called spinal stenosis. And spinal stenosis is basically narrowing of your spine. Narrowing in particular of an area of your spine on the side there called the lateral recess. The lateral recess and the neural foramen. So a lot of people don't understand spinal stenosis, not even doctors. A lot of doctors don't understand spinal stenosis. But spinal stenosis means narrowing of the spine. And there's really four areas, actually five areas, but the fifth one's not really spinal stenosis. So let's just say four. There are 4 areas or zones in the spine where you can get stenosis, okay? The first is central, right in the middle of the disc, right in the middle of the spine. That is extremely rare to cause spinal stenosis. That's symptomatic, okay? Like less than 1 in 1,000. The second place is called paracentral, which means just to the side of the center. That's just on the side of the center, but not quite under the facet joints. The lateral recess would be the third. And then finally the foramen, which is even further to the side, is the fourth. True symptomatic spinal stenosis, it comes from lateral recess and foraminal stenosis. So in the third and fourth positions, which are very far to the side, which is why laminectomy doesn't really work. Laminectomy treats central and paracentral stenosis. It doesn't treat lateral recess stenosis, and it doesn't treat foraminal stenosis, because the lamina is only in the center and paracentral region of your spine. So if you're doing a laminectomy, which is an old surgery, and I don't do them anymore because they don't work. So a laminectomy itself doesn't work. It only treats central and paracentral stenosis, which accounts for less than 1 in 1,000 cases of stenosis that's symptomatic. Okay? That's why people get these surgeries done, laminectomy, and it doesn't work. They still have leg symptoms, weakness, numbness, tingling. Great question. So, spondylolisthesis itself doesn't cause symptoms. Lots of people have spondylolisthesis, 0 symptoms. What causes symptoms is annular tear, which is what we fix with Deuk laser disc repair, and lateral recess foraminal stenosis with nerve root compression or irritation, which is also what's fixed with Deuk laser disc repair. And the Deuk laser disc repair, our version of laser spine surgery, is the very best treatment in the world for discogenic back pain from annular inflammation and for foraminal and lateral recess stenosis. Thanks for joining us. We're done with the cervical spine facet treatments. We're going to be back shortly with her lower back. She has lumbar facets as well. L4-5 and L5S1 facet joints are arthritic and causing severe pain. We're going to go and perform our Deuk plasma rhizotomy to eliminate facet joint pain at L4-5, L5S1 permanently. Thanks.